I'm Wright Clayton. I'm at Vanderbilt University, where I co-founded the Center for Biomedical Ethics and Society. I'm also a professor of pediatrics and professor of law. I've been involved with pediatric ethics for a very long time, going back at least to my residency, and have really been focusing particularly in recent years on pediatric issues about genetic testing, both in terms of newborn screening and in terms of the implementation of new genetic technologies in the clinic. Well, I'm on the National Advisory Board of this program, which is a really wonderful program and in many ways unique, bringing together students who are already involved in the clinic, taking care of children in a variety of different roles, who have the opportunity to sharpen their skills, because they obviously had some to get here in the first place, to sharpen their skills in addressing these issues and to really bring them to bear on some of the issues that are really most troubling to them. The only other program I know of that does pediatric bioethics is at Seattle Children's Hospital, but I don't know if it's multidisciplinary or not. Boy, that's a great question, and it ranges the entire gamut. One of them is that the majority of factors that actually adversely affect children's health are actually outside the medical center. They're the food we eat, the air we breathe, poverty, stress, violence, all of those things. So addressing those issues to improve the health of children is actually a critical bioethical issue in pediatrics, and one that I think that people who actually work with pediatric bioethical issues have a major role to play. On the other hand, we have also the issues that are presented by dramatic advances in our technologies, not only in what goes on in the intensive care units, and advances in what's going on in genetics, many other areas, and really figuring out how to use these technologies in a way that serve the interests of children is really profoundly important. And of course, at the heart of all of this is actually, doing our best to address the complex interactions of parents, children, and the various people in the healthcare system in addressing the needs of children and families. So, all the old problems we had didn't go away, and we've got a whole bunch of new ones. Well, I certainly recommend actually multidisciplinary training, because I think that that the problems that we face in pediatrics, in fact, require understanding of social systems more than we used to have in the past. Clearly, there's a need to understand ethical and philosophical norms. So I would say that what the skill that they need to have is to understand the array of issues that affect ethical issues in pediatrics, and understand where there are issues, and either how to get more information on their own or how to figure out how to collaborate to move forward in ways that really that move forward in helping children. So both being able to identify the full array of the problems, having particular skills, including the skill to ask for help when you need it. Well, I think I just described how I think you prepare yourselves to deal with them, and that is to realize that any problem that we faced is going to require a really broad-based approach that really looks at all the factors that are brought to bear in terms of addressing the problem. I actually think there aren't too many new problems. What I do think is that we will see the problems that we faced in the past present themselves in new ways. And so we just need to be alert for those going forward.
Is there anything else you'd like to say about the Children's Mercy Bioethics Center?
Well, I think the idea that the approach is deliberately multidisciplinary is extremely important, because there's no one discipline either that can understand the whole problem or that can address the whole problem. And I think that the idea of bringing together people with different disciplinary backgrounds, opening the opportunities to expand their horizons to look at further disciplines is absolutely the way to go.